Welcome and thank you for joining me today to celebrate this year's World Health Day. Well, I'm sure that many of you are already thinking that we've spent the entire year talking about health and safety and broader well-being. So what can another day add to that? Well, I would agree with many of you if this year's topic hadn't been eliminate health inequities for a fairer and healthier world for everyone. The global pandemic has indeed uncovered and deepened inequalities between the different groups of people, races, ethnicities, social classes, but also global regions. Never before access to health, but also economic sustainability for household have been so strictly intertwined, but also so fundamental to life and survival. It has also pushed healthcare providers to rethink how healthcare is delivered and adopt alternative solutions to include all the people, because access to health, as this day aims to emphasize, is one of the fundamental rights that every human being should enjoy. Innovative solutions from payment systems to delivery to tracking systems have helped us in the past year to manage our life as we've experienced firsthand. Today at Galen Growth, we will focus specifically on digital health innovations, which have proven to be life-saving during the ongoing crisis, but also aim to deliver on the promise of increased healthcare access, affordability, and quality for all. I'm joined today by a global organization working on advancing sustainable development goals and by two innovative digital health startups to explore the relationship between health and innovation. Welcome Artak Melkonyan, Chief Operating Officer of SDG Innovative Finance for the APAC region, Muriel Tiambo, co-founder of KimboCare, and Shamala Hinrison, founder of Hanai. Thanks for joining. Start with Artak with a bit of introduction of yourself and the role of UNDP in advancing SDG 3. So what are you guys doing?
Okay, thanks, Anna. Actually, that's interesting because I'm not a health professional as such, though UNDP does have quite a large, extensive, entirely healthcare devoted team in many countries, and there is this whole direction, a pillar within UNDP work which relates to health. I myself come from the other part of the organization, which looks after working with the private sector on whatever relates to engaging private sector into targeting sustainable development goals. Now, through not only their donations, but through their entrepreneurial acumen, technologies, businesses, all sort of resources which are available there. Now, yes, and because not only that, but we also try to private sector in addressing the health issues. And last year it was, hence I got involved in, addressing things related to healthcare on both aspects, the COVID response and now also post-COVID recovery, and trying to organize that engagements. Now, and again, those engagements, the way we look at that is through, I would say, through not only technologies, but sustainable technologies, economically sustainable technologies. In general, yes, we have SDG number 3, and that's one of the major sort of things to look at, which is connected with many other SDGs. But the area that UNDP specifically looks at is connection between SDG 3 with SDG 1, which is poverty. It also relates to other things like climate, work, equality, sustainable consumption, etc. So our approach to the health issues are more based on, I would say, systemic approach. We look at the sort of accessibility of healthcare services, especially to those who we call vulnerable groups. And we know that, we have issues related to both the tropical diseases, HIV, non-communicative diseases such as cardiovascular, cancer, chronic, respiratory, and many of those are coming because of the overall, I would say, life conditions or access to different resources, not only health-related resources, but food, climate issues, etc., which are affecting it. So we look at the healthcare more from that holistic perspective, and trying to understand what are those connections and try to address the issues holistically. Now, and again, that this relates to such aspects as reducing inequalities, and removing all sort of exclusions, and trying to build, I would say, a resilient and sustainable systems for healthcare, and make healthcare as a universally accessible sort of value to as many people as possible in this globe, actually. So now the part, whereas many programs that are happening in that, again, we try to work with the governments on the sort of massive healthcare issues, but what I was sort of working on, especially last year, is trying to identify those technologies or technological solutions which are addressing COVID response, and that was a priority, but now also to overall recovery aspect, post-COVID-19 recovery aspect.
Yeah.
And here again, we look at all sorts of solutions, not only related to specifically, I would say immediate response, but I would call it a whole range of solutions, which we call future of healthcare, and making healthcare accessible to larger circles. The way we were trying to do it is through either working with R&D and making those technologies available throughout the world. I mean, again, those are very new areas for us to step in, because as I told, we have had more traditional areas in healthcare where UNDP was specialized, such as vaccine distribution, for example, would be one of those things that we are doing in a massive scale. And we work especially with such countries as India, etc. It's a heavy reliance on UNDP resources on doing that. Now, in this particular case, we were trying to find those what we call growth stage ventures, which do have interesting solutions that could be supported and scaled, but not just solutions, those solutions which are, I would say, transformative and systemic, because we all know that the resources are very limited everywhere, especially when we speak about development. So from that perspective, our approach was, let's come up with something what we call acupuncture approach, right? Again, coming from medicine, but we are speaking about acupuncture in a systemic change, finding those areas of intervention where intervention creates disproportional impact vis-a-vis the resources spent on that. So that is why we were looking at this concept of impact ventures, transformative ventures, systemic ventures with that impactful solutions. And yes, and we were looking at some sort of unusual partners in doing that, such as venture capitalists, venture funds. Why? Because they are quite sort of keen to go into very risky areas of emerging markets. And B, which is probably the most important aspect, is that the venture capital is very talented in finding super performing teams or super performing ventures which are coming up with products and services that are transforming markets significantly and fundamentally. And this is how our sort of interests coincide, and this is why we start looking at the methodologies, approaches, incubators, accelerators, VC sort of type of vehicles, to see whether we can try to reach to those interesting ventures and try to support them and to, I would say, amplify and accelerate it further through our own resources, our own reach, providing visibility to them through our access to both media, to governments, etc. And that has happened actually.
So I am Muriel, co-founder of KimboCare, and I am an entrepreneur and a strategist career. Strategist by career as well. And then so we created KimboCare, which is an end-to-end technology platform. It really came also from something very similar to what Artak mentioned, right? So how do we connect SDG 3 and SDG 1? And then so our personal story is that we actually, myself and my co-founder Frank, we grew up in Cameroon, Africa, and then we went to Europe and studied. And so we've been out of the country for about 15 years now. And during all those years, we had to help our families back home to, continue, just have like better life as well, like access to doctors and things like that. So a number of needs, including access to healthcare. And then so for us, we would also realize sometimes that as much as we wanted to help, we would often find ourselves very frustrated because we would not necessarily be satisfied with the quality of care that they would get, or because those are places in the world where a lot of people, including our families, have often had to choose between, going to the doctor and having food, right? That sometimes they would actually use the money for something else. And what we would then also realize is that sometimes they would get back to us and be like, oh, I didn't go to work today because I still have this issue that I told you about. And I know you gave me money, right? So, or someone else will come back and say, oh, I didn't go to school because my tooth is hurting. And then we will be like, but we gave you money a month ago. Why are you not going to school, right? And then so for us, it was really like, where do we need to start to see our families a little bit more, so to speak, financially independent, so to speak, right? And then it really came clear to us that health was an area where we needed to focus and find a way to do it in a way that we eliminate the frustration, right? And that's how we decided we started to think about KimboCare, right? A way to empower our families through better access to healthcare. And then in that process of creation, right, we realized that by talking to a lot of people, running a few workshops and market studies, we realized that we were not isolated in that sort of like situation and frustration. So people from, I don't know, Latin America or Asia, or even in some places in the US, do face that same issue. So what we decided was that, okay, it seems like we actually, so again, another term that Artak used earlier, seems like we are faced with a systemic issue, right? So how do we put a systematic answer, a systematic solution towards that systemic issue? And then that's why we were like, okay, it felt like very clear that we had to really create something that's scalable, like a real solution, a company. And that's how we created our dear KimboCare. We've been 1 year in operations. We are already active in West Africa, in 2 countries there, Cameroon and Ivory Coast. There is a lot to do. It's been a tremendous journey. We completed our pilot in December. So moving slowly towards the, next phase of the journey.
That's amazing.
Yeah.
Yeah, it's fantastic.
I can say more later. Let me stop here.
Yes, let's continue, Shamala. Thank you, Muriel.
Hi, my name is Shamala, and I am the founder of Hanai. Hanai is a Hawaiian word, actually. It means to take care. And I think it's really lovely to come off after Muriel and Artak have spoken, because I almost don't need to say anything much anymore. So it's nice. But what I want to pick on, and as I introduce, is a couple of things that Artak mentioned with coming up with impact measurement tools, because that's one of the things that we are aiming, or at least trying very hard to achieve, is that at least giving these analytical answers and decision-making tools to those who need to make decisions, rather than just anecdotal or what someone saw somewhere, or just, and also the wastage of money and funds, like when someone comes and replicates the thing over and over again because the data is actually not documented and translated into an impact-driven decision. What does Hanai do and why? I'll give you a little bit of history to it. I'm a medical scientist by training, and my career was completely in research, medical communications, and then at policy for government. But it changed when I did a 4-month sabbatical where I took on a volunteering gig for ICRISAT. It's one of the UN arms, research arms in agriculture, actually. And I mapped the rural healthcare landscape of India, but across the board, rural India, north to south. And one of the things, my second baby was just 6 months old at that time. So it was a pretty, not young in age, but just a young mother of a young child, and walking around the country. And I kept meeting all these moms who either had never met a doctor in their lifetime. And I think up to 90% of them will never see a doctor in their entire lifetime. And their focus, something to the point that Muriel said, where they would focus much more on food rather than their healthcare whenever they got their next dollar. And that was more and more prevalent everywhere I went. And, or it turned to simplistic things where they would judge me because I had no television at home, although I lived in a developed country and did developed country things. They were like, what do you mean you don't have a television? What do you mean you cycle to work? Like, that was just so bizarre. But at the same time, I got to enjoy healthcare, which they did not put it as a priority. And that is the nature of life. And Muriel explained this. When you have other priorities like feeding your children, feeding yourself, keeping yourself entertained, when you have only 1 hour of free time in your entire day, everything else comes apart, right? If you've got a lump, you let it go until the very last, and probably you never see a doctor and you'll never know that that lump is what killed you. So that was the scenario. 2 things. And that got me thinking, there was these mobile phones in everyone's hands, but no doctor coming to them. So it's nothing novel, greatly innovative in that. Now, why were we replicating the same things of getting people in with the flyers? Why not just use that phone? And that started the idea, and that got me going. And so we created the pilot, ran bits of it in different countries. And just at that point when that was happening, I'm originally from Malaysia, and I read about a mother who died hemorrhaging after giving birth to a child in Malaysia. And that caught me completely off guard, because in my mind, coming from West Malaysia, if anyone of you knows Kuala Lumpur, you cannot imagine that. You're like, what happened here? Like, how did that happen? Was it tragic? But it was a very simple thing where the doctor turned her back. And I was like, how did the doctor turn her back? Like, what's going on? I had 2 children by that time, and I knew the scenario so much. So she was in East Malaysia, in Borneo, which is just a completely other world, the disparity between East and West Malaysia. And I began to dig deeper, got in touch with the relevant people. And we launched our first product about a year ago called Jiwa Ibu, which means mother's soul. And very targeted at indigenous women in East Malaysia, in Borneo, which West Malaysia, in all its, in all its development and everything else, is completely forgotten and neglected. Like, a woman might have to travel 6 hours to get to the closest doctor. Maybe in Kuala Lumpur, you need 6 hours to get to the closest doctor, but it's because of a traffic jam, not because you actually, right? This is the reality.
The reality.
Correct. So that was one layer of it. And a little bit more, when is an emergency an emergency? So our focus, at least for those communities, or with the first Jiwa Ibu, was very much maternal health focused. We work closely with the healthcare ecosystem of Malaysia at large. So, and then we added on mental health, because it goes together. And while that was happening, we picked, like, if we used a persona, if a woman is already in a situation of domestic violence or under hardship with mental health issues, when she gets pregnant, all of that is just magnified. And how do we give her the tools? How does she know that now, okay, if I have a temperature, my feet are swelling, I'm feeling dizzy, how does she know that this is actually an emergency? How will she get to the doctor? And very simplistically, Malaysia enjoys pretty good internet connectivity and pretty good digital penetration, and a lot more also on smartphones, which is great. So we could create a product that targets that, and very much in health literacy, just trying to bring that education level up. And speaking locally, if I were to use the words and speak to someone and say, you have a cardiovascular issue, and I say it in English like this to a woman who's had 3 years of school, it's very off-putting, and you go like, okay, I rather believe it was a ghost that was possessing me at that time, and hence I felt this constriction. But if I tell her it's your heart, it's what allows you to feel love, and that also is now having a problem, you need to do it. So localization, speaking in local language, not only in Malay, which was the major language there, but also in all the various indigenous languages, and coming out with videos. We got that tightened. I'll speed it up along. We got that done, and it was working well. We're getting a lot of good data to be able to also backtrack it the other way. What we were hitting there was the nutrition component. I think it's SDG 2 and definitely SDG 3, but also always, like all of us in this conversation, always focus on equality. The scalability, replicability, we are now working with a cohort of teenage moms in Kenya. Again, maternal health issues, and and menstruation, like when menstruation is like an evil thing, and how to bring this education level up. The girls have handphones, they have their smartphones, and if not, we're looking at using a USSD SMS system for them to still keep working at it. How do they feed themselves well? How do they feed their babies well? How do they keep up with schoolwork? How do they prioritize their health while not just trying to think, maybe I should just join the next hair salon and start making money? So the good thing that we have found out is that our product is replicable against any geography. Healthcare information needs to be extremely localized, but thankfully, as the medical sector developed globally, I think about 60% is still translatable. And then you have local things like what vaccines are available, what treatments. Like, in a developed Western European country, you would have an ultrasound scan every month. But if you tell that to a woman in Kenya, if you read it, be having ultrasound scan every month, but you've never seen one, it's much more demoralizing. You make someone feel worse than they originally felt. And at the same time, giving that data back then to the local healthcare authorities, the local healthcare organizations. How many women are actually doing their checkups? Who's vaccinating their kids? So as I said at the onset of our call, and I could go on talking, but with lots of respect to the others on the panel with me, I would love to hear a lot more.
Can you explain a bit better how UNDP, or within the realm of SDG, how is impact defined or measured?
When we speak about impact, we have to look at this overall concept of, I would say, sustainability, and integration of sustainability in business ventures, right? Because by default, business ventures are there to target what we call shareholders' benefit. So the ultimate purpose of any business, if you recall your economics course, is to maximize the profit. And this is where we are saying, wait a bit, let's start thinking about, rather than shareholders' benefit, let's talk about the stakeholders' benefit. And stakeholders here being everybody, from communities, from neighbors, neighborhoods, governments, customers, suppliers, literally everything, everyone which is this or that way is somehow connected to a business. So one strategy here is, again, expanding that from shareholder value to a stakeholder value. Another concept, and this is where we try to sort of move along this curve of addressing, benefit generating or creating good to the others, the businesses usually speak about something CSR, corporate social responsibility. This is when the business tries to do something good for the community it works, etc. But usually that something has nothing to do with the nature of the business. It's more like a PR type of activity to look good in the eyes of the government, the people nearby, etc. Which is okay, but what we try to do, we try to nudge the ventures going into something called responsible business. When there are a set of rules, set of principles, and those principles and rules and values include both the human rights, but also some of the things related to environment, social aspects, etc. And we are saying, listen, why don't you do your business in compliance with those principles? And those are as simple as, okay, and I am oversimplifying, but such as don't exploit kids, don't discriminate women, don't cut the trees, etc. So those are some sort of principles. And what businesses do, they try to have their business processes structured in such a way that we are not violating those principles. But it's more about compliance, and we try to have that compliance for all the processes, from supply to manufacturing to sales.
Okay.
Literally anything that business does needs to be compliant. But that's not it. Now the next stage is what is called sustainable business. This is when we speak about business not harming. So we are saying, listen, compliance is nice, but it's not enough. Let's now think about not harming where you work. So if you cut a tree to build your plant, why don't you go and plant 10 more trees so that you can offset it, so that the damage that was done to the environment is somehow compensated, right? If you are sort of polluting the environment because you pour your, soft drink into a PET bottles, why don't you create a facility to go and collect those waste, bottles, right? And clean the plastic. If you are putting a sugar drink and sell it to the population, why don't you look after providing that population with drinking water, right? So those are the type of things when we speak about responsible business and sustainable business. But our ultimate point, what we try to advocate, is when we are saying, listen, all these approaches are nice, but what we really want is for you to target an impact, make an impact as something measurable, and make an impact as one of your corporate targets. So again, the compliance is nice, it's not enough. Let's make this creating good. Let's define what is that good. Let's parameterize it, and let's start measuring our progress towards generating that good. Now, with SDGs coming in, we are saying, and we will try to formulate that good in the context of Sustainable Development Goals. So it's not just a standalone impact, it's actually a contribution to the Sustainable Development Goals, which are actually global visionary target for all the governments, all the countries, all the people. And now we are telling you, okay, your contribution is this much or that much. Second principle here is that we are not very comfortable when people are saying, oh, you know what, I'm targeting SDG number 3, or I'm targeting SDG number 2, or whatever specific SDGs, because when we know that we are creating a potential problem, when only one aspect is considered, because we believe into the holistic nature of that, into this interconnectedness, and we have seen what is happening when you are just focusing your attention all on one thing. And we've seen many such projects, probably not that much in healthcare, but let's say in microfinance, we have seen microfinance bringing to bankrupt villages, or we have seen affordable housing resulting in creating new ghettos, right? We convert what we call a horizontal slum into a vertical slum, or the same PET bottles. 20, 30 years ago when PET bottles came, plastic bottles came into, oh, this is nice energy solution. We do not need to, spend a lot of energy on transporting glass here and there. So it was really nice. But now we understood, wait a bit, we didn't consider the full impact of what we have done. And it was done, the connections were not identified. The time frame was very short term, and that created a problem. So that is why we are speaking about holistic approach towards impact. Again, measuring it. Well, first of all, defining it. Second, making it as one of the targets we are not saying make that target above your financial performance or your market performance. We are saying make it as one of your corporate targets. And once it is a target, you need to go and start measuring your progress towards achieving that target. So, and this is, in a nutshell, what is our approach towards impact measurement and management. It's not easy thing to do, I should tell you, but what we are also seeing is that those who are doing that, they start getting not only what I would say impact benefits, but we start getting business benefits because it makes ventures more profitable, and there are studies which shows it now. And it's not anymore an anecdotal thing. It is like there are a bunch of studies recently, about 3 weeks ago, there was something called a meta study, a study based on more than 1,000 different studies, which have proven that 60% of ventures which start doing it become more profitable from 5 to 12%. But most important, and this is what we have also seen during COVID-19 crisis, those ventures which are doing it, they become much more resilient towards crisis times. The reason being that impact measurement itself is much more advanced task than any type of financial management, because you start identify your connections with all your ecosystem, all the stakeholders. And once you have an updated information about those connections and all the risk and all the possible interdependencies, that makes your company much more resilient towards the changes. And this is what has been also absolutely proven during the crisis time, that those which are integrating sustainability into their business decision making become more resilient.
If I could jump in and query a little bit, because this is fascinating. One thing is holding everyone accountable, holding people accountable when you run a business to see where's your impact factor and things like that. But there are also a lot of social enterprises, I think, like Muriel's and mine, like KimboCare and Hanai, which have come out completely building it off the platform of let's look at the social part first, and then we build a business around it. Let's make sure that we can support ourselves or support magnificent teams or keep it sustainable. And one of the aims there, and at least for me, I will speak for myself, and I'm quite sure it's the same at Muriel's, it's you want to avoid the going there and seeing that same poster painted over by 10 different development agencies, right? Like you want to avoid, like if you go into any, I will speak from my experience. I walked into Mozambique, and there you see that first USAID had been there 18 years ago doing that same thing. And then Danida came there 5 years ago and is doing the same thing that was done 18 years ago. And then it just repeats and repeats. And I find social enterprises then have a space to sort of knock that out. Let's the grant money go to the big where it needs to go, and let sustainable businesses build around it. And I'm quite curious, Arta, to hear where that falls into the portfolio of encouraging it. Like a lot of the time, I think those who come with social enterprises, they would have a sound. The impact factors is probably what's defined more clearly, and the business sense not defined so clearly. Do you have anything to add to that or explain on that?
When we first started this creating frameworks to bring private sector to development, and the first thing that we looked at was actually what is called social entrepreneurship, right? Because it was so close to what development people are doing. And the first, for example, impact accelerator that we had was entirely focused on social enterprises, and also several cohorts afterwards. Also, we were sort of trying to focus on social enterprises. What has happened though? We understood that it's super difficult to scale a social enterprise. You know, the success rate is very low. It is comparable with incubation process, not even acceleration, right? What I'm trying to speak here is about the acceleration where, let's say, out of, I don't know, if you take average cohort being like 10 ventures, out of 10, probably 5, 6 are going to perform very well, like scaled tenfold, right? Now, from that perspective, social enterprises were super difficult to scale. But we are still working with them because that's a source of inspiration, and it is also a source of some of the, I would say, impact scaling approaches and methodologies that are very important for us. But what we decided to do is said, listen, our purpose is not to concentrate on a narrow niche because it seems that it's super difficult to scale that niche, but rather to go after the mainstream and convert the mainstream guys into becoming more impact oriented. So the strategy was changed here. So we said, let's go to the businesses and try to see whether we can augment their impact component. And this is what started happening. And this is where we start putting social enterprises with what we call impact ventures. That is businesses who we have converted to become more impact oriented. In such case, it starts working much better from the perspective of both scaling the social enterprise and also making the business more impact oriented. So, and this is the part of our strategy of mainstreaming impact, right? And that starts working now. And this is what we have seen. And we have seen, by the way, we have seen many businesses which were much more effective social enterprises, but we never called them social enterprise. You go to them saying, oh, guys, you know that you look like a social enterprise. Come on, what's social? We are business, we are making business. You know, so that was there, right? Now, it's another thing that, yes, we need to explain, again, this holistic approach, these interconnections, and there are many other frameworks that we try to implement here also to showcase those interconnections. This is something which I wanted actually to bring as an example of impact measurement and management for healthcare, right? We work within the country to address the diabetes 2 as one of the challenges, right? Now, and previously, all the efforts to address diabetes 2 within that limited area, which is a district in the big city, was entirely based on the concept of medical services. So yeah, I said, oh yes, let's set up a clinic specialized in diabetes 2. So the government pays for the constructor to come and build the clinic, when put the equipment, when hire some doctors to run it. But actually that is not creating an impact. Why? Because what we understood that, listen, but diabetes 2, the service, medical service is only one of the components to address the disease, right? What is important there is to address the nutrition. So when the second layer came into play, saying, oh, now we need to address the nutrition in that particular area in terms of, you know, the food that it comes there, whether the carbs are put on. So, you know, let's say on the shelves in the supermarkets, let's put low carbs on visible area, the high carbs down there. So to change the pattern of nutrition there. And when we said, oh, but this is not enough, right? So there is also the third component, which is lifestyle. So a third enterprise came in saying, oh, now we need to address. So we start building the playgrounds in the yards. We start organizing these weekend sport activities, etc., so that people start moving, you know. And now we know that the disease is addressed at 3 different levels: medical services, nutrition, and lifestyle. Now, the point is that unless we bring in this sort of impact factored framework where government, for example, pays not for the clinic, it pays not for the playground, but it pays for reduction of the disease rate. Only under that scheme, this sort of combination of those three working together is possible. So because so far, the way usually the government works in addressing healthcare, we are saying, oh, let's build a clinic, hoping that the clinic will resolve the disease, right? In the best case, we have something called performance-based something, and when we are saying, oh, you know what, we will pay per patient which are served in that clinic, which is also not the ultimate solution.
Yeah, like a value-based thing.
So in order to address the disease, you need to make it complex. And when you need to look at the holistic impact, which is actually reduction of the disease rate rather than how many patients you have served, how big is your building, how nice is your equipment there, etc. So these are the type of things that are quite practical. And that is why I'm saying we need to bring those, all the layers and when connected through this concept of impact measurement.
Got it. Clear.
Yeah, I think this was very well described because one thing that we really also put at the center in relation to that is really, community participation versus also community engagement. I think also from everything we've studied as we were sort of like building KimboCare, as we started building KimboCare, it's like the challenges that we're going after, like you were saying earlier, there has been a lot of attempt to address them. But also when we read through what was done and how it was done and the fact that things were done, but to some extent, many were not lasting. What consistently came as a common pattern was really that level of community participation. And I think the type of things that HealthTech with that sort of like diabetes enterprise, I want to say it that way, kind of like discovering, right, social determinants and the effect of those social determinants. So we're not only working on the access to healthcare, but we're also working on the access to health. And the only way to get to that access to health, which gets into an entire now concept of population health, right, the prevention, which in so many of those parts of the world, that prevention thing is not adapted yet. Again, back to, we wait until we're almost dying to actually go to the hospital, right? So how do we convert, literally, how do we build the social movement around prevention so that people take care better of their health, and we can help them to some extent with the tools. And then, so in terms of like what we're doing also at KimboCare, again, which is a platform that connects a donor, a giver, to a medical partner, right, that provides quality to a patient that needs the care. But one thing we also adding with KimboCare is really the health. So that's also why I really like what you're doing, Shamala, because there is a lot of like education that gets into it, right? How do we start to educate people at large scale? And then only when needed, then we have the infrastructure that we need to deliver the care. So one thing that we're really looking into is really like the in terms of metric for the sustainability is really the conversion of people, of the masses into the prevention, right? How many more people over time gets sort of like adopt the programs that we're putting into place, and how many fewer of them are getting into the clinics because they have been following some of the other programs that we, the satellite educational program and so on and so forth, or they're coming for a checkup annually. A lot of people don't do that. They don't even know that it's something that is important if you don't want to spend too much money later down the road on healthcare. So we have a list of impact and sustainability, but I think really the part about community participation and prevention is really something we're looking at very closely to drive sustainability around our business solution here.
If I could add on to Muriel's point just a little bit, is building of the community. At least what we found in the geographies is go for the grandmothers, go for the aunties. Like they seem to hold the power to be able to like completely revolutionize this preventative care, right? Because our metrics, like Muriel's, is completely based on how many fewer, like how much less, like how you know how many more kids are able to live past the age of 6 because of our intervention? How many, you know, things like maternal mortality are very linked, of course, extremely linked to medical care. That is the main thing you need to do. It is happening at that instance, but still, like knowing that something symptomatic during your pregnancy is not caused by being possessed by the devil, but rather an actual medical condition. That goes so much into the preventative care education, trying to find the voice that speaks. There's a lot of work that cannot be, you know, running a business as well, like Muriel, like that needs to be translated very quickly also into a dollar. Like that's how we're going to keep ourselves going. But trying to find that sweet spot with working in translating that so quickly, but also, you know, on an agenda-wise, preventative care cannot happen in a year. You cannot get into it for the short run. Whereas, you know, having a doctor chat service, yes, you can convert that very much quicker. But preventative care, just, it's the words that we started this conversation with, systemic change. It takes so long. You need to go to the head of the families. You need to go to the head of the communities. You need complete governments to change how they advertise food and health. So yeah, we have found, we're talking to the grandma house.
Yeah,
I love the grandma house thing.
Wide societies, so it's change in that scale takes time.
The one thing I would add, Artak, is that you have here 3 great impact ventures. Because I think, and Shamala, I think we've spoken before. So I think you have also that same sort of like approach to building Hanai. It's really this idea of how do we create social impact with a robust, scalable business model. So in that along those lines, we actually found ourselves where we have like normal, so to speak, investors that are like, you know, approaching us at first, not necessarily because they want to play in the social field, but because they see a business model that is meant to grow. And I think with organizational agencies like UNDP, startups like that, or impact ventures like this, it feels like something that's kind of good, at least to explore, because then we're talking about global impact. We're talking about really impact at large scale. And then, so me, definitely personally, just like Shamala, I'm looking forward to continuing the discussion and exploring more. I think it would be great visibility to the work that we're doing, to the impact that we can create, that we have started creating. And yeah, even if it's not money, it's visibility. The word is going, spreading.
Or just like in this conversation, just learning about others. I think I'm quite sure it's the same for you, Muriel, and Artak. It's for me, like every single day, while sometimes it's a struggle, just learning about someone else doing something, like what you just said, the fact that someone hacked it, someone got a device into Indonesian midwives to bring it forth. Like how phenomenal is that?
Yeah.
Right? Every single day that's a story that makes me go, I'm so glad they did that. Like,
yeah. Thank you for sharing the article.
Yeah.
I've just shared over the chat box the article. Both are from Forbes, from different accelerators. These are HealthTech Ventures, which we supported. One is about that African company which provides healthcare access to rural areas. And the other is more like a type of a robot which is used in the hospitals for treatment of kids which are in the hospitals. Both were accelerated by us, both were featured by different journalists, not the same one. And many of, we have also a couple of ventures which are not that much in healthcare, but in some other areas, which are like a superstars. Once we have introduced them to the world, to media, all of a sudden we have Reuters, Deutsche Welle, CNN, BBC running after those guys. Like we had another venture in Indonesia which produces a leather from fungus. So it's like it's sort of, and they are selling now that to all sort of high-end brands like Gucci and all sort of like that. And all the international media are speaking about those guys. I can send you the links to that, not healthcare related, but something which is really sort of cutting edge. But these ones are the ones which I've just shared is, again, it was there and because people do want to hear about those stories, right? And these are real stories, real people and real impact. Definitely.
It's quite encouraging, for people willing to do something. It's, okay, someone made it, so why not try? Give it a try. So
this Forbes correspondent called me back saying, "Oh, do you have other ventures? Women?"
Yes, we do.
We have one in Pakistan. There are two more in Indonesia. We are now launching the whole entirely devoted to women empowerment accelerator in India. So again, I think there has been a change in the world, and people do look at impact stories, definitely, and practical impact solutions.
One last question for me, just for my curiosity, your next steps. Where do you see yourself at the end of the year, to the three of you?
Muriel, I'll let you answer first, since I always tend to jump so quickly.
And then you're gonna have nothing to say. I think during our first year we were pretty focused on our pilot, and then on building our technology, leveraging the insight from our pilot. So technology-wise, operations-wise, we feel pretty comfortable with the robustness of what we have. And then so this year we're working on, a few expansion plans, including locally and also internationally. So we'll see. I think a lot of cooking in the kitchen, but I think the bigger thing is really bring more visibility into KimboCare now that we know that we can handle significant volume. So we're working, and along those lines, we are really working on, of course, the marketing aspects of it, like the typical marketing type of activities, but also establishing a few winning partnerships, like potentially with the UNDP, and so on and so forth. So so really an exciting year ahead of us, and it has already started great. So really exciting.
Good luck.
Thank you.
And our part is
exactly. I hope to hear on these things at the end of the year now.
I think on our part is scaling. Right now, we've shown that our methodology can work like even in two extremely different ends of it. And so we're looking at a few more countries that we are planning to expand into this year, at least start the work in getting into that, be it in some Francophone African countries and rest of what we can manage with our telco partners and things like that, establishing stronger partnerships. We have a model that's working very close with the telcos, because there's no point trying to bring a mobile phone embedded aided solution if someone doesn't have connectivity or no mobile phones. So we're working that, learning and moving that. on a very personal level, I really hope that as we all get vaccinated, to be able to actually travel to the sites where our work is in, to be able to stand in Kenya and work with the women who are doing the work on the ground,
Yes.
be able to go back to Malaysia again and eat and enjoy it. Yes. So I wish Uriel and Artak and you, Anna, all the success as you all go through your various plans in the year.
And what about you, Artak? What are your
Oh,
goals for this year?
So the goals are, again, to scale up, continue developing the network of our accelerators. This year, we are launching one in India and in Malaysia. In Malaysia, actually, there will be several lines, both the corporate ones, startup-focused ones, even the ones which are funded by quasi-governmental structures there. So Malaysia is probably the most championing country this year in this direction. When continue scaling up this health tech direction with whoever are Cullen Grove, Drapers, and the others. But now what I'm looking at is making more sort of a long-term accelerator, which is supported by the investment fund. And also we are getting some sort of interest from the corporate players to support a health tech accelerator on different matters. And the third direction, what we are doing, we start providing a lot of, say, impact advisory support to the mainstream players. And this is very important because you go and try to convert the, I would say, capitalist-minded players into becoming more impact-oriented, and that actually works. And this is what creates a massive change, because what we see, people not anymore asking why we should do impact. They are asking how we should do impact. Tell us. So it's not anymore questionable why someone should, look at those things, right? So this is a new direction that we try to develop, and we try to make it in such a way that we do not lose our impartiality, and still be able to bring something to, and especially bring private sector into this development area. Yeah. So this is where we are.
Yeah, quite a busy year ahead for all of us. Okay, if there are no more questions or curiosities from any of you, I would thank you so much for being part of this conversation. I personally enjoyed it. We'll definitely be in touch with all of you, and all the best for your goals. And we'll talk in different situations throughout the year. So yeah, thank you so much again.
Thank you.
Thank you.
Thank you.
Thank you,
Bye.
everyone. Bye.